Valdez Hospital. I'm doing my EMS instructor methodology course, and I'm doing a 15-minute or so block of instruction on being a PA.
Oh yeah, works good.
There we go. So what is a PA? We kind of mentioned it a little bit before. They have several different names, either mid-level provider, advanced practice clinician. Some people get into a peeing contest over the proper term. I don't really care. You're basically competent in all the basics of healthcare, kind of like what she was talking about. We can specialize, which is an advantage over MD, which we'll get to here in a minute. God, that's a lot of glare. It's about 3/4 of medical school and about half the time. We don't have a residency. Do you guys know what a resident is as far as the doctors go? Anybody know what a resident is? It's when they've graduated medical school, they have their full doctor, but they don't get to work on their own. They have to have a physician overseeing them. We're kind of like a permanent resident. Differences in MD, DO, PA, and nurse practitioner. So MDs and DOs are what you think of as your normal docs. They've gone through 4 years of undergrad, 4 years of medical school, and then at least 3 years of residency, and if they specialize further, it's more and more residency. Nurse practitioners, they have to be a nurse first. A lot of them require so many years of nursing, actual field experience, and they do a nurse practitioner program. Some of them are completely online, which is very nice as far as just getting through school. Some of them are hybrid, some of them are in person. And then some states, depends on if you're an independent provider or if you're a dependent provider like PAs are. PAs, we always have to have a doc that always signs off on our stuff. You know how it is as a paramedic, like when you're in the truck, you're at the call, you're on your own, but someone else is ultimately responsible for your paperwork. It's the way it is with us. Some places, like in the ER in the hospital, we have a doc that's co-located with us. When I work urgent care and stuff part-time, you're it. Whatever walks through is yours. And some doc just signs your paperwork sometime that month. So our scope of practice, we evaluate, diagnose, treat, and or stabilize patients just like docs do. We can prescribe medications, we can order and interpret laboratory studies. I have my DEA license. There's pretty much very few things that I can't do. In North Carolina, the only thing that I'm aware of is you can't do the first exam on a psych patient actually fully finishing the commitment process. You can do the involuntary commitment part. You just can't be the one to formalize the final part, and you can't start surgery by yourself. Anything else, if you're trained and you're competent and your doc says go for it, to the best of my knowledge, that's it. So we can do RSIs, we can do thoracotomies, we can do chest tubes, we can do all sorts of stuff, especially at the ER side, which is really kind of nice. Being a PA lets me do pretty much everything that I want to. Job outlook, it is definitely increasing. You guys have seen the population is aging. It seems that people are sicker in general, and there's evidence to back that up. And also there are a lot more people that have medical insurance now, or the possibility of getting medical insurance than there were before. So there's a need for a lot more providers, be it docs, NPs, PAs, whatever. All of them are going up. How it is as far as being a PA, average pay for America as a whole is $102,000 a year, which is not bad at all. It's not what docs make, but I'm definitely not starving. So I like it because it lets me work in an environment that I enjoy. I really like working in the ER. I really like the people that I'm with. And the advantage of being a PA is if I get tired of emergency medicine, I can go work for a dermatology practice next week. And dermatology is actually one of the more sought after PA jobs. They make really, really good money, and they work 9 to 5. Most of the time have Fridays off, and you're probably not going to kill anybody or get sued. Like, it's really nice. That's something to consider if you're thinking about PA versus doc, is you can change your pathway. So I have talked you into it. We make good money, we work good hours, we get to do fun stuff that we enjoy. If you're looking at going to PA school, you need a bachelor degree in something. You need patient contact hours for almost every school. General requirements, you've got to have your general chemistry, your biology. A lot of places you have to have your organic. Some places you have to have physics. What I did was I looked at all of the possible prerequisites and made a Excel file. All the possible prerequisites across the top, all the schools that I was looking at across the side, and just went through and put check boxes and figured out, like, it was worth it for me to take genetics because it'll let me apply to all these schools. It wasn't worth it for me to take physics because it would have tanked my GPA and it would open up a few more options. So if you guys are looking at it, that's what I would strongly recommend you doing while you're still looking at which classes am I going to take, and hopefully you're better at physics than I am. PA school is generally 7 semesters over 2 years, averages out about 27 months or so. First year is classroom work, kind of like what you guys are doing now. You go through all of your anatomy, your physiology, your pathophysiology, your pharmacology, a little bit more in depth than paramedic school. And then you do 1 year of clinical rotations. Generally they're about a month long each. You do family med, internal med, psychiatry, emergency med, and then most places you have at least 2 electives. And then you finish up with your PANCE, which is like your national registry on steroids. It's no fun, but it is what it is. So, where to attend PA school? There's a lot of schools in America. The ones that I looked at in particular, I wanted to stay in North Carolina because I was working as a medic for Lake County at the time. Campbell has a 3-year dual master program in public health and physician assistant studies, if that's something that you're interested in, if you really like the public health side of stuff. ECU is by far the cheapest in-state school, and at the time that I was looking at it, it was the only in-state school. The problem that you run into for you guys that are actually looking to go into school, you have to finish up your prerequisites the year before you apply. And I wasn't willing to have a dead year, so I kind of ruled it out for whatever that's worth to you. Lenore is right up the road. Wake Forest has a satellite campus up in Boone, as well as Winston-Salem. I went to the University of South Alabama. South Alabama was nice because you can actually get in-state tuition in the morning. They have a card. You have to have like 1 in column A, 2 in column B, and I got my driver's license, my insurance. Did you have your hand raised or you scratching your head? No. Driver's license, insurance, bank account, and my concealed carry permit. And that, God bless Alabama, that was enough to cut my tuition in half. Paying for school sucks. You guys saw the prices. It's no fun, and that was just the price of tuition, not the price of living and eating, and I like to eat. I wound up using a combination of student loans and my GI Bill, and I still owe a lot of money, but it's worth it. So again, the lifestyle is nice, the pay is definitely nice. Student loans are no fun. There's other ways you can pay it off. Public health service. The VA has actually started a scholarship now. One thing people have asked me is, can I work during school, especially the medics? I would not plan on it. I know a few people that would work like 12s or 24s on the weekend for the first part of the year. Their grades took a hit, and I'm not sure it's worth it. So in summary, why am I a PA? When I was doing my paramedic time at Fry, I was looking at PA school versus medical school, and every single doc and every single PA told me if they had to go back and do it again, they would have gone to PA school. The doc said it just wasn't worth the pay versus the school versus the loans for what they got to do when the PA's got to do almost everything. Like in the ER, literally the only thing I can't do is I can't sign that ERIC form. So we fill out the ERIC form and the doc signs it. Like, it lets me do everything that I want to. Doesn't pay quite as well as a doc, but again, I'm obviously not starving to death. And I also like the freedom of movement between specialties. So again, if my wife says you're done working nights and weekends, you need to find a 9-to-5 job. If you guys go on any of the job sites, there's PA jobs all around. So, questions, comments, rude remarks? Yes?
So you're saying, even with that one, I guess it was ECU that you were talking about, that's so much cheaper. Like, say I already went through all my nursing prerequisites at CVCC, do those count towards?
You'd have to look and see when they expire. I know a lot of the schools ask you like for the last 5 or 7 years. So I was actually a history and political science major. I wanted to be an intel officer. Figured I'd join the Guard as a medic. It'll be fun. Deployed and realized I really like this and I'm halfway decent at it. So when I came home, I had to start from scratch doing all of my science stuff. So for me, I was doing my prereqs right before I wanted to go. You're in a different boat and you're probably a whole lot better off than I was. My problem would be I would finish up my organic chemistry or whatever my last class was, and I couldn't wait and apply until the next year, and I wasn't willing to have a dead year. Does that answer your question?
Yes.
Anything else? Do you have anything you were thinking about school? Anybody? Bueller? Awesome. Well, thank you guys for your time. Sir, thank you very much for letting me crash your class. You guys have been awesome. Good luck.